Whole foods, defined as plants or animals in their unaltered or minimally altered states, provide a matrix of macronutrients and micronutrients in physiologic proportions. Vegetables, fruits, whole grains, lean animal proteins, and cold-pressed oils supply fiber, vitamins, minerals, and phytonutrients without the inflammatory sequelae associated with ultra-processed products. For example, minimally processed olive oil contains predominantly monounsaturated fatty acids and polyphenols, e.g. the hydroxytyrosol, that inhibit cyclooxygenase 2, COX2, and attenuate prostaglandin E2, PGE2, synthesis, pathways implicated in both systemic and cutaneous inflammation. Likewise, whole grains, e.g. oats, quinoa, deliver soluble V-glucans that modulate postprandial glycemia and support gut barrier integrity, indirectly influencing immune-mediated skin conditions. A pragmatic dietary template might include breakfast: steel-cut oats topped with mixed berries, anthocyanin-rich, and a handful of walnuts, a linolenic acid source. Lunch: mixed greens salad with grilled salmon, long-chain omega-3 fatty acids, cherry tomatoes, avocado, and a drizzle of extra virgin olive oil. Snack: carrot sticks with hummus, legume-derived protein and fiber. Dinner: stir-fry of lean poultry or tofu with broccoli, bok choy, bell peppers, and brown rice. Intermittent indulgences, such as a slice of artisan sourdough, a modest portion of dark chocolate, or occasional pizza, are acceptable so long as they do not dominate caloric intake. The key clinical principle is consistency. The majority of dietary exposures should reinforce an anti-inflammatory biochemical environment conducive to optimal skin barrier function and dermal collagen integrity. To optimize dermal architecture and cellular turnover, specific nutrients merit focused attention. Collagen precursors and amino acids: glycine, proline, hydroxyproline, abundant in bone broth, collagen hydrolysates, and gelatin. These substrates feed dermal fibroblasts to maintain type I and E3 collagen synthesis, preserving skin tensile strength and elasticity. Long-chain omega-3 fatty acids: eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, found in fatty fish, salmon, sardines, marine algae. These lipids compete with arachidonic acid for incorporation into cell membranes, shifting eicosanoid production toward less inflammatory resolvins and protectants. Provitamin A carotenoids and preformed vitamin A. V-carotene, A-carotene, retinol, sourced from orange and dark green produce, carrots, sweet potatoes, spinach. Vitamin A modulates keratinocyte differentiation and inhibits follicular hyperkeratinization, a key process in acne pathogenesis. Supplementation carries risk of hypervitaminosis. Thus emphasis is placed on dietary intake. Antioxidant vitamins C and E, ascorbic acid, and A-tocopherol, crucial cofactors in collagen hydroxylation and free radical scavenging. Rich sources include citrus fruits, berries, nuts, and seeds. Clinical studies indicate that combined supplementation of vitamin C, 500 mg day, and vitamin E, 400 IU day, can reduce UV-induced oxidative damage in dermal fibroblasts. However, whole food sources deliver additional phytochemicals, flavonoids, polyphenols, that work synergistically, advantages not replicated by isolated high-dose supplements. Emerging evidence positions the gut-skin axis as a pivotal regulator of systemic immune responses and cutaneous health. Dysbiosis, characterized by reduced microbial diversity and impaired epithelial barrier, permits translocation of lipopolysaccharides, LPS, and other microbial antigens, perpetuating toll-like receptor, TLR activation, and cytokine release. Addressing gut health through diet can attenuate this cycle. Prebiotic fiber. Non-digestible oligosaccharides, inulin-resistant starch, from onions, garlic, bananas, and whole grains fuel beneficial bifidobacteria and lactobacilli. Probiotic fermented foods, low-sugar kimchi, sauerkraut, refrigerated brine versions, kefir, and plain yogurt supply live cultures that transiently colonize the colon, secrete short-chain fatty acids, SCFAs, and reinforce tight junction proteins, occludin, claudins. Clinical intervention trials supplementing 5 grams of inulin and 1 serving of homemade sauerkraut daily for 12 weeks demonstrated significant reductions in serum zonulin, a marker of intestinal permeability, and improved psoriasis area and severity index, PSI, scores in mild to moderate cases. Patients also reported decreased frequency and severity of acne flare-ups, underscoring the utility of integrative dietary approaches for inflammatory dermatoses. Diet is one facet of a multifactorial approach to skin health. Additional lifestyle considerations include sleep hygiene. Nocturnal skin repair is mediated by growth hormone, GH, and melatonin. Obstructed or fragmented sleep elevates cortisol and disrupts circadian rhythm, impairing lipid barrier restoration. Aim for 7 to 9 hours of continuous, high-quality sleep per night. Hydration and electrolyte balance. Adequate water intake, approximately 30 ml/kg body weight, ensures optimal hydration of the stratum corneum, reducing transepidermal water loss, TWL, and fine line formation. Electrolytes, sodium, potassium, magnesium, support cellular osmoregulation. Alcohol moderation, ethanol and its metabolite. Acetaldehyde increase dermal capillary permeability, promote reactive oxygen species, ROS generation, and impair sleep architecture. Limit to IPL 1 standard drink per day. Stress management. Psychological stress activates the hypothalamic pituitary adrenal HPA axis, elevating systemic cortisol and neurogenic inflammatory mediators, substance P. Techniques such as the physiological sigh, 2 rapid inhales through the nose, followed by an extended exhale through pursed lips, non-sleep deep rest, NSDR, meditation, and yoga demonstrate efficacy in reducing salivary cortisol by up to 30% after a single session, correlating with fewer stress-triggered skin flare-ups. When counseling patients on improving skin appearance and function, clinicians should adopt a holistic, evidence-based framework. Assessment. Obtain dietary history, sleep patterns, stress levels, and gut health symptoms. Goal setting. Establish realistic targets, e.g., 5 servings of colorful produce daily, 2 weekly servings of fatty fish. Behavioral interventions. Provide meal plans, recipes for fermented foods, and sleep hygiene checklists. Monitoring. Track inflammatory biomarkers, CRP, IL-6, dermatologic scores, e.g., investigators' global assessment for acne, and patient-reported outcomes, PRA. Iterative adjustment. Modify recommendations based on patient response, tolerability, and preferences. By integrating nutritionally focused, lifestyle-oriented strategies with conventional therapies, topical retinoids, photoprotection, systemic agents, practitioners can achieve superior, sustainable improvements in skin health, transforming the integumentary system from a passive indicator into an active partner in whole-body wellness.